Hi, I'm John Lind, the founder and chief editor of Healthcare IT Today, and we're excited to bring you this great interview. We have Alessandro Sabatelli. He's chief product officer and co-founder of Braid Health. Welcome, Alessandro.
Thanks, John. Excited to be here.
Yeah, so tell us a little bit about your background and really, before you got into healthcare.
Sure. So let's see. I have a computer science background, and have really been applying those skills towards design and interaction design specifically for the past 20 years or so. I spent about half of that at Apple, where I had the real opportunity to lead interaction design for some pretty broad-reaching products. Everything from Siri to reminders, leading animation for iOS 7. Had the opportunity to work on the watch and have really been thinking about how humans not only interact with machines, but really interact with each other as mediated by machines. And I look to apply those skills in general to large scale problems.
Nice. I mean, this is really interesting because I think the number one comment I get on my blog is why can't Apple come into healthcare and improve healthcare? So it's fascinating that you're working to do that. And I think it's also interesting your co-founders from Twitter. So that's some pretty interesting background. And really, coming out of those two companies, you guys could have done anything. I mean, you could have approached any problem you wanted. Why did you guys choose healthcare?
That's a really good question. I mean, I think we've both had the opportunity to work on large scale products that affect millions or billions of people. And what we like to think is ideally have made a positive dent in this universe. But as we were working together, and we've worked together for many years on and off, we've gone through our own stories and our own interactions with the healthcare system. I lost both my mother and my mother-in-law to cancer, and given the skills that we have, our ability to actually do something there really sort of drove us. And I think part of it is also our own naivete, and we've been learning as we've jumped into healthcare sort of head first. But it's really been eye-opening, and we just sort of had the questions as to why is it like this, or why can't it be another way, especially when you're dealing with timeframes and situations that feel so and that are so so important and so critical. You really start to ask questions, and the way that we both sort of think about things is in that critical way, and we like to ask questions. And so we dug and as we were looking to see what we were going to do next, we started experimenting with the application of particularly around artificial intelligence in healthcare, considering that Kevin had built up the AI stack at Twitter, which was used to run everything from the timeline to revenue. And I had really been starting to think more about proactive design and really thinking about design holistically. And as we started to dig into the places that we could really apply our skills, we started to hone in on really the delivery of medical expertise, particularly around radiology.
Nice. So we're going to dive into that a little. I think it's interesting that you admit some naivety with healthcare, because I've always said that I think the way healthcare is going to be disrupted is by combining a few really technical, naive, but skilled people with a healthcare professional who understands the reimbursement models, the structural decision making, and if you combine those two together, it's a powerful construct to be able to do it. So, and I think I should change my question from now on when I talk to a new company entering healthcare. Instead of saying why did you choose healthcare, I should say what's your story, because it seems like that's what happens with almost every founder. So, anyway, it's great that you're bringing Braid Health to healthcare. healthcare. So tell us, what is the big vision for Braid Health? You talked a little bit about AI and radiology. Is that the big vision? And what are you working on today?
Well, I mean, it's really focused around the delivery of medical expertise, and that focus is really hyper focused on imaging and imaging diagnostics. It's what we experienced, and as sort of being the roadblocks that we were running into in our own personal stories, and ones which we thought really could really benefit from the technologies in many ways that were already existing. We didn't need to go out and spend years to do research in order to develop technology to address these problems. From our vantage, we could see that many of the technologies were already existing, and that the path was, perhaps shorter than we had thought as we began to dig in. And so what that means in practice is that anybody anywhere in the world should be able to get diagnostic imaging interpretation in seconds instead of days or hours, days, weeks, months, and there's no reason that that shouldn't be the case. And we already see this in radiology today, where the radiologists are not evenly distributed. Of course, they want to live in city centers. I think systemically this has been fought by, increased salaries in rural areas, but we don't necessarily think that that's a sustainable solution, particularly, as you get outside of the United States. And I think fundamentally, we're all people, and I think this is sort of a basic human right.
So is your solution going to read the radiology images using AI, or are you going to forward the image to a network of radiologists, or what's the approach?
Yeah, that's a great question. I mean, we think about it holistically, and that those design skills that I was talking about really have taught me to think about these problems holistically. And so we think about them in terms of the people that are involved. So the providers, the patients, the specialists. And it's not about one of these things, it's about all of them in concert working together in order to solve the problem of delivering that diagnostic. So it's the diagnostic itself, and it's also getting that diagnostic to the person, and connecting those. So it's actually both. And we believe in many ways in what technology has been doing for millions of years, which is essentially allowing humans to work on things and expand their capabilities, and removing much of the drudgery. And that's really where we began. We really began focused purely on AI, and then we realized that it was also about the delivery of that intelligence. And we began to work there as well. And then we realized, as we began this sort of march, that it was also about, securely delivering that information and building it in such a way that all of these things could come together in order to deliver that expertise where it was needed.
Yeah, I mean, your timing's interesting since we just had the first FDA-approved AI reader of a radiology image. So you're on the curve, it sounds like, to do either direction, which is a powerful idea. Now, do you sell to the radiologist, or are you going direct to patient, or how are you going to market with that?
Yeah, so we actually began in Southeast Asia, and we began there by providing essentially overreads for radiologists. And that was essentially customer driven, but providing that in a way that is operating in real time, essentially to provide a safety net for doctors that are going through, in some cases, single doctors going through thousands of images a day, which is really intense, but they have different conditions under which they work, where the number of healthy patients is much higher. And so we were able to essentially hone the system there in terms of the models, and then being able to bring the technology here and begin to deploy it in a way where it's really focused on, in a similar way, where the expertise is needed the most. We've been focused almost exclusively in the United States on urgent care, where the urgent cares don't employ radiologists, but
Hmm.
they do have that need. And so they've typically been served by teleradiology, but we think we can do a lot better, and we've been proving that out.
It's interesting to take it to the urgent cares. And do you see this? I mean, it sounds like you're already thinking internationally since that's how you started, or is the U.S. really the main focus, or what's your approach international versus U.S.?
I mean, we definitely think about it as a global problem, and there's some interesting advantages that we have by working on a global scale. One of them being, for instance, radiologists go home at night, but they're awake somewhere else. And that's really interesting when you start to think about like the intelligence of the radiologist as augmented by machine and then delivered on a global scale. We have that advantage because we work, across time zones. So we definitely think about ourselves as a global company. Of course, different places have different problems that need to be solved, and they all have their own cultural constraints as well. But I think it's that diversity as well that makes us stronger and allows us to actually deliver better service wherever we are.
So you've started with radiology, and it's interesting that you're working in urgent care centers in the U.S. Are you looking to expand it as part of that bigger vision of really, helping medical expertise be spread? Or is this just the beginning, or do you think you'll be a radiology company?
Those are all
Do you
really
even
good
consider
questions.
yourself a radiology company?
Um,
You probably don't even consider yourself a radiology company, I bet.
yeah, that's a really interesting question. We, we generally are trying to solve the problem of the delivery. And so, of course, like there are many types of or different forms of expertise out there, and there's many places that it needs to be. So, maybe we think about more of ourselves as a healthcare delivery company.
Hmm.
Radiology is really interesting because I think at heart we're also an imaging company. That's where a lot of our expertise has come from, and that's really interesting in and of itself because images. People are particularly drawn towards imaging. Most of our actual gray matter is devoted to processing imaging, and like you show somebody a picture of an X-ray and you point out something on it, they can more easily understand than if you have them read, a radiology report. And so even in that case, like we've been thinking a lot about like, well, how do we change the way that we report on imaging to patients so that they can actually understand? Because in many ways, it's the same problem: is how do you get information from an expert to a non-expert in a way that they can understand, and then have that non-expert be empowered by that information so that they can expertly convey that information to a patient who's arguably even less of an expert. And so we think about it in that way, and that sort of maps in many ways to some of the technology that we built around AI, which is essentially a mapping or a translation problem. How do we translate from the expert to the patient?
And do you have learning in there that your experts that are doing the reads can inform your AI process to improve it over time, or how are you approaching the learning around images?
Yeah, that's a really good question. There's a ton of data out there. I think the sort of data silos, particularly around the areas that were focused, started to fall about a year and a half ago or so. So there is a ton of data out there. It's not necessarily all very clean. We employ radiologists as well that help us work through some of that data, as well as data that we get from our customers. And we've built an active learning loop that allows us to then retrain on that data. And the goal is always to get to the point where we're training in real time and learning in very federated ways so that we can provide the best service possible wherever that may be on a global scale based on the populations that are there. And we've also been able to see that with respect to, again, working in Southeast Asia versus the United States, really getting an understanding of what's different there between the two, and where we can focus on them individually.
Yeah, one big thing that's probably different is how you pay for it, right? So what is your business model? Who's going to be paying for this? Is it the provider? Is it the patient? Is it the insurance company, employers? What's your approach there?
Yeah, I mean, typically our approach has been focused on the providers, or the actual the clinics that are providing the healthcare. It's allowed us to move more quickly, and prove out our offering as we start to open our horizons with respect to who our actual customer may be in the future. But those are the decision makers, and that's allowed us to move pretty quickly.
I think it's ironic you said that the providers were the way to move quickly, because I think every person that's sold to providers usually says it's such a slow process, but they do have some autonomy. So if you have the right solution, I think they can move quickly. Sounds like what you've seen.
Yeah, I mean, yeah, exactly. It's once they see our offering, they understand, not only does it allow them to provide a better patient experience, which allows them to, of course, like market and reach out to the market more fluidly. But they also see the impact on their margins, and that combination is what we hope is pretty irresistible.
Yeah, well, and I think especially in the urgent care market, there's been such a consolidation that's been happening that it's more and more corporations that are owning these, or hospitals and health systems that are more business driven, as opposed to onesie, twosie doctor practices that may be totally satisfied with what they have and they don't need much more. Have you seen that in your efforts, or have is it really the doctors pushing it forward, or is it more the corporations that are growing up these networks of urgent care centers?
There's a pretty broad spectrum. I think a lot of hospital systems are building out urgent care as feeders into the systems themselves. But I
Sure.
think fundamentally the patient still has their expectations, and when people have the opportunity to go online and compare and review ratings, it's on sites like Yelp, it becomes pretty clear who's providing the best service. And I think at the end of the day, the patients win, which I think is a really good thing. I don't think you can just slap urgent care on a building and get by. I think you actually have to really compete at that patient experience level. And again, I think that's what everybody wants. I think that's where the market is going. And again, I think it's really good for everybody.
That's great. Well, yeah, I think it's great that you're coming and bringing an outside perspective to healthcare. Although I just have to ask you, a lot of people have tried this. I often say that the reason that so many tech people come into healthcare is because once they become billionaires, they can't buy one thing, which is extended life, and so they start investing. Oracle did it. Even the former Apple CEO, he's in healthcare. And so it's like, okay, the one thing you can't buy with billions of dollars is extended life, so they try to invest in healthcare. And no doubt they've tried, and many of them, some limited success, but no real breakout successes. So I guess I would just ask you, what do you think that you bring to the table to really solve the problems of healthcare when so many others haven't been able to do it so far?
Yeah, I mean, well, first of all, we surround ourselves with people that do have that experience. So I think that's like secret number one. Though you can make the same argument for many of the other players, even the ones that you mentioned.
Sure.
I think we're really passionate about it. Like going back to that first question that you asked, like why healthcare? I mean, this is the thing that keeps us going, keeps us working late nights, weekends, whatever it takes, because we see the real impact. And for us, having seen that impact and in the work that we've done before, but actually being able to see it in a way that viscerally affects people, where they are today, as opposed to where we can take them is incredibly powerful. And I think, at the same time, we've been able to touch so many things that we believe that our experience through these different technologies, and many of which, again, like I said, exist already today, I think uniquely position us to deliver a solution that actually makes a difference. And that goes back to the question that you asked also with respect to like where our focus was, and that's why it's been more work and a bit of a larger effort, but we realized early on that we had to do many things and not just one small thing. Developing an AI algorithm that looks at chest x-rays and attempts to diagnose particular conditions is not a solution. It's really about that. It's about empowering the radiologists so that essentially allowing them to move the field forward more quickly, being able to essentially extend their abilities so that and like humans in general, their expertise, so that they can service more people with more accuracy and do it in a way where they're not burning out and they're not spending all of their time, whether it's filling out reports or coding or whatever, but really actually being able to push the boundaries of healthcare and deliver that at scale. So that's us taking our skills and applying it to what we see as the problem at large.
I think it's a beautiful description of what we really need in healthcare, right? It's not even, a lot of people talk about replacing the radiologist, and to me, it's exactly what you described, which is how do we enhance what they're doing and enable them to be more productive and more accurate. But I love also that it sounds like you guys have a connection to the patient as well, and pushing the results to the patient and doing it in a way that they understand, which provides that full spectrum, which I think is what you talked about.
Yeah, I mean, I think it's also, it's not just crushing the time to getting an accurate diagnosis. It's about like presenting it in a way where the patient can actually understand and really, empowering them so that, they can agree to a plan of care and stick with it, and have it be stable, one that's not going to change ideally unless, the conditions are changing. I think those are really important because at the end of the day, like in many of these cases, the patient needs to actually, and we've all been there, the patient needs to be the one that drives that healthcare.
Nice. So, let's look at your experience at Apple. And certainly this could be things you're applying at Braid Health, or maybe stuff that other people in healthcare could apply. Were there certain things you learned at Apple, some lessons, some mantras, some experiences you had, or approaches that they took to design, that really apply to healthcare, whether it's at Braid Health and everything you're doing in your company, or just in healthcare in general? Are there things we should do? We often, discuss the iterate, release early and often, kind of a startup principle, right? And how does that apply to healthcare? And can you do that in healthcare? Can you not, right? Which I think is a valuable discussion to have, and things like that are important in pushing healthcare forward. Is there any principles or things that, approaches that you learned from Apple that could really benefit healthcare and maybe you use at Braid Health?
Well, we definitely tend to think about things holistically. We try to really understand, what the issues are, as opposed to necessarily what people are asking for or what they think the solutions would be. We certainly take that, under advisement, but we definitely try to think about it holistically. And in the development of whatever technology or software that we're creating or whatever experience, we certainly know that, in healthcare, you can't just like fail often and break things. People's lives are at stake, and the people around them as well. I think there's a balance there. We want to move quickly, and not necessarily get bogged down. I mean, I think the general mantra is do no harm, or some form of ahimsa, but I think it's a balance. And we're always looking for that balance, but being balanced, is something that constantly requires effort. Yeah, and I think in general, we've seen throughout our careers that there's things that we like. We like small teams that are hyper efficient. We don't have to deal with a lot of overhead. We like working with the best people in the world, and those are the people that we surround ourselves with. And people like us that are really driven, motivated, and passionate, really about seeking the truth, and trying to make as much of an impact as we can in a positive way. And so, for us, that mission is really important. And I think, that empathy towards that mission is equally important in the people that we work with.
Excellent. Well, thanks for taking time to share about Braid Health, and I'm looking forward to see how the company evolves and see what you guys are able to do. And I love that you're bringing some of the tech design, and I love the holistic approach. It's certainly needed in healthcare. So thanks everyone for watching, and thanks to our guest, Alessandro Sabatelli. He's Chief Product Officer and co-founder of Braid Health. If you want to find more great content like this, check it out at healthcareittoday.com. Thanks, Alessandro.
Thank you. Thanks for the opportunity.